All right, well, hello everyone and welcome to our webinar today. We are focusing on effective practices for community needs assessment today. And this is part of our Organizational Standards Center of Excellence peer-to-peer webinar series. So we've been doing these webinars now for most of 2018, focusing in on different topics. And instead of us talking at you at the Community Action Partnership, we are giving peers across the nation at local community action agencies or state associations the chance to share their best practices and what they're doing around certain topics. And so basically just giving you a chance to hear from your peers on what's working and hopefully give you some things to adopt and replicate and ideas from others. So just wanted to give you a few housekeeping items before we jump into the content for today. Today's event is being recorded, and so this will be able to be found in our webinars portion of our resource library on our website. And so you can go to that within about 2 business days to find the recording, as well as a PDF of the PowerPoint slides from this presentation. Also, everyone is muted during this webinar just to cut down on background noise. However, we do encourage you to send in questions as we go along. So you can use your chat box. Hopefully you see some icons at the bottom of your screen, and you can go to the little chat bubble, and that's where you can send in questions throughout the webinar. We do ask that you send these in to all panelists. If it's content-related questions, if you just have general content questions or general comments that you want to share throughout the webinar, you can send those to everyone for your peers to see as well. And I think that's about it as far as our housekeeping items go. If you do have any technical difficulties during the webinar, again, you can go up to that Communicate tab in the upper left-hand corner and see if you can adjust your audio to make it better quality. Or you can try chatting me and I can give you some technical assistance while our peer presenters are presenting. All right, well, we'll go ahead and jump in. I'm just going to give you a brief introduction and then I'll hand it over to our peer presenters. Today we have Erin Wicks from Action for a Better Community out of Rochester, New York. And we also have Lori Lincoln Swain, and she is from North Alabama Community Action Partnership. So you'll be hearing from both of them on what practices they've been doing for their community needs assessments. So part of the foundation of this webinar is looking at really making sure that the community needs assessment is aligned with ROMA, which is that results-oriented management and accountability cycle. And so, you know, really this is where we connect the community needs assessment into planning and of course the implementation of services and strategies, achieving those results, and then using any evaluation and data analysis throughout that whole process to feed into the next planning cycle. And so this is really where we highlight the importance of the community needs assessment in this full ROMA cycle and how all of these pieces are connected. Then the organizational standards is another piece that we want to highlight today. So of course, there's a whole category around community assessment for the organizational standards. You know, hopefully many of you are familiar with what these are, but you know, doing a community needs assessment every 3 years to remain in compliance. Also, you want to make sure you're collecting current data that's specific to poverty and has a relation to gender, age, race, ethnicity for the community action agency service area. Also, being sure that you're collecting both qualitative and quantitative data, as well as analyzing that data. So there's a specific call out here to make sure the data is analyzed, not simply collected, and that we have a comprehensive set of data. So we have both numbers and statistics, as well as that qualitative data that is coming directly from participants in the community, telling us more about those causes behind the conditions of poverty. Then also, of course, we're looking at how the community assessment needs to include those key findings on the causes and conditions of poverty, which really comes from successfully achieving standard 3.3 as well. And then, always including the board of directors in that completed community assessment, not just giving that formal acceptance, but including them in key points throughout the process as well, even though the standard is just specifically calling out that formal acceptance. So, those are those compliance pieces. We, of course, want to meet the organizational standards, but ultimately we want to both meet and exceed the organizational standards. And so this training hopefully kind of facilitates ways to not just meet those organizational standards through the examples you'll see, but also exceed them in ways as well. So the partnership promotes 5 different steps to your community needs assessment in a lot of the trainings that we conduct. And so I just wanted to show those here before we have our peer presenters present their processes. I think both of them kind of go through a similar process as this. This isn't the only way to do it, but most agencies kind of go through some similar cycle as this as they do their community needs assessment. And so our peer presenters are going to present on what has worked through some of these steps effectively, how they comprehensively collect and analyze their data, and really integrate that ROMA cycle and achieve those organizational standards. So at this time, I'll go ahead and turn it over to Aaron Wicks. He's from Action for a Better Community out of Rochester, New York. Aaron?
All right. Thank you, Courtney. I'm hoping that our presentation today is useful in giving people some ideas about how to approach the community assessment, because I know it's something that we struggled with a lot. Let's go to the next slide. So let me just give you a quick history of what happened within our agency, and I would guess that some of these discussions have gone on at your agency as well. For years, we had a community assessment that I always sort of called the cavalcade of data. It was this huge document that was very dense. It had tables, it had graphs, it had descriptions of tables and graphs. It had tons of information, but no one was using it as a planning tool. It was so data heavy. As well as sort of analysis heavy in the sense that there was just a lot of verbiage in there that you really had to sort of read through it with a fine-tooth comb to find what you were looking for. And one of the challenges that we had was that many of the issues that we would write about, we would have entire sections that would be dedicated to major issues in the community. And so for an example, housing, people would say, well, what information do we have in our community assessment about housing? Well, are you talking about the age and condition of the housing? Because that's relevant to weatherization. Are you talking about homelessness? Are you talking about affordability? Are you talking about rental issues with landlords and absentee landlords and those sorts of things? Are you talking about the location and availability of public housing versus, city and suburbs, public housing use and issues and policies, foreclosure issues? I mean, the list goes on. Those are just some of the items. So, when someone says, I need some data about housing from the community assessment, our community assessment was really not helpful in answering that, because you had to basically read a little mini book to find what it was you were looking for. And the big question that came out of all that was, so what? Why is all of this relevant? What is the bigger story here? That's a question that Barbara Mooney is always whispering in my ear, at least in my head. If I hear voices in my head, the only voice in my head that I hear is Barbara Mooney. And she's always saying, so what? So what? So it finally got to me, and we decided we needed to change our structure. So next slide. So we decided to think about how we could make our community assessment consistent with the CSBG Foundation, as well as the ROMA framework. So CSBG, the legislation is very explicit about the causes and conditions of poverty. And so the community assessment, needs to describe, what are the conditions of poverty? Who's in poverty? How many people are in poverty? What do they look like? What are their experiences like? But then also the causes. So why do those conditions exist? And what I realized was our community assessment was heavy on conditions, but not very solid in terms of causes. And then when you look at ROMA and what ROMA demands of a community assessment, it wants the community assessment to be a tool that can be used for planning. So that document should be the foundation that says, how do we respond to all this? What are the outcomes that we want to achieve? And then if we achieve those outcomes, do we know that we've actually reduced the need that we identified? So our existing community assessment, the cavalcade of data, was not doing that. Next. So we adopted a format that I call a narrative, and that may not be the best name for it because it's really more a collection of cause and effect statements. But just for the sake of ease, I'll stick with calling it a narrative because that's what we've been calling it. So our community assessment now consists of several narratives, and each of those narratives has 4 components. One is a clear statement of cause and effect. Because of X, some cause of poverty, Y occurs in the community, a condition. So right there is your CSBG legislation. Each narrative is very clear in saying, because of a certain cause of poverty in the community, the following condition results. Next, we talk about the scope of the challenge. And that's where we get into the conditions primarily. Who is disproportionately affected? How many people? What data demonstrate that this causal relationship exists? That's where you can get into what Courtney was talking about earlier with regard to the organizational standards, things like age, gender, race, ethnicity, and other factors, because certain causes of poverty affect different groups differently. And the key part of this element of the narrative is to say, so who is it that is most affected by this particular cause and condition? Then the third component is kind of a summary of contributing factors. And this is where we try to pull out what are the key drivers, what are the key causes. The way to think about this is, where are the points of leverage in this narrative? So if the narrative is about a lack of jobs, then the contributing factors should give us some idea of why are there not enough jobs in the community? What are some of the key factors? Are they historical? Are they structural? Where are the points that our community might look at to make changes? And then the last component is opportunities for progress. What are the resources that exist in the community right now relative to this cause and effect? What programs or services already exist? Who are the key actors in this area? We found that this was actually a very difficult element to complete because we realized that no one really knows all of the resources and all of the key actors. But it's a great place to start creating that list so that when you engage in the planning process, you can go to your key stakeholders list in your community assessment and say, okay, I need to start talking to these folks, and I need to be reaching out to these organizations because they're already doing something in this area. And I think if there's one thing that distinguishes community action from other community organizations, it's that we start at that point. We try to build on existing community resources. We don't try to reinvent the wheel. We don't try to go it alone. So this is an opportunity to emphasize the partnership role that we play. All right, next. So let me just tell you a little bit about the intuition from ROMA that we used to come up with these components. And then I'll finish by just sort of talking about a sample narrative so you can kind of see what they look like in action. So the statement of cause and effect is really critical to get us thinking about what's the level of the issue. Is it family, agency, or community? Think back to ROMA training that you may have provided or that you may have received. One of the most important things that we can do when we identify a need in the community is identify what kind of need is it. And so that causal statement is where we do that. The fact that unemployment is high, well, in most communities, that's going to be a multi-level type of issue. It's going to be a community level issue because very likely there are not enough living wage jobs available. But it's also likely to be a family issue because there are going to be issues that serve as individual barriers to participants. And so they might need help with resume preparation or job training. So that need exists on a couple of different levels. So in our community assessment, we have two different narratives that address joblessness. One is a family level narrative, and one's a community level narrative. So that's sort of the ROMA intuition behind the cause and effect statement. In terms of the scope of the challenge, if you think of your logic model, this is the area where you're defining the need and quantifying the population that's affected. Because if community action is going to be a problem solver, and we want to be able to measure the progress that we're making, then we need to have a baseline that says, what's the scope of the problem in the first place? So, in a perfect world, you'd have a logic model where your community needs assessment says, X thousand of local residents are affected by this aspect of poverty. And as a result of that need, here are some of the strategies that we would pursue, and then here are the outcomes, and those outcomes then should contribute to the reduction in the number that you identified in your need. Now, I know it's never quite as easy as that, but if you can really do a good job of identifying the scope, you've got the key section of your logic model already in place so that you can do your planning. Contributing factors is another component of the planning process in the logic model, because again, if you've identified those effectively, then you've pretty much identified the strategies that will be either included or at least will be considered for inclusion in a logic model meant to address the needs. So earlier I referenced employment being an issue. Well, the strategies that might address the availability of living wage jobs in the community, those strategies presumably would focus on those key contributing factors that your needs assessment identified. And then finally, opportunities for progress. As I said before, I think this is key when we think about the role that ROMA plays, because this is where the key partnerships and resources are going to be identified, or at least where they're going to start to be identified. And again, I think it's a wonderful opportunity for community action to distinguish itself as that community catalyst, that convening table that brings together community resources to focus them on the causes and conditions of poverty. So that's why I think the opportunities for progress component of each narrative is so critical in terms of our ROMA framework. Next. So how do we identify the narratives that we would include in our community assessment? I think that's pretty straightforward. It's really the same process that we use to identify the topics or subject areas that we've historically included in them. So, one place that we want to be cognizant of is the legislative focus areas identified in the CSBG legislation. Remember, the legislation talks about education and cognitive development. It talks about income, infrastructure, and asset building, and I think 5 or 6 other areas that are meant to be focus areas for CSBG. So certainly those can inform the narratives that you feel should be included in your community assessment. You also want to think about your existing programs and services. Presumably they exist because of needs in the community. So at a minimum, there should be a narrative in your community assessment that explains to the community why you have the programs and services that you have. So that shouldn't be the extent of it, because obviously there are going to be needs that go beyond what we do. But it'd be a really important base to cover to make sure that your community assessment is well connected to your agency's existing portfolio of services. And then, of course, stakeholder feedback is a key component of the community assessment process. And so that would include input from the board, from staff, from customers, from community partners. And then let me just also add that before Roma NextGen, we also used the 6 national goals of community action to structure our narratives. And so we tried to think of narratives that would address each of the 6 goals of community action. And that was helpful, I think, in particular, to make sure that we addressed the agency level goals in terms of partnerships and increasing community capacity, agency capacity to achieve results. Because those often don't get as much focus in community assessments. But we found that it was useful to go out and talk to other agencies and say, what are your capacity issues? Do you struggle with the same things that we do? But one key note that I just want to provide relative to the narratives, you have to be realistic about what to expect as you seek input for narratives. People that don't write community assessments and who haven't used this type of approach aren't going to think in terms of Roma. They're not going to think of, because of this is the result. So when you go out and ask for input, don't worry about trying to have other people write your narratives. Just go out and do the data collection that you always do. Ask people, what are the important issues? What are trending issues? What's working well? What's not? Do your usual data collection, but then pull out of that, when you do the analysis, pull out of that the narratives, because they're usually pretty obvious. Okay, next slide. Just one more comment about data. In developing your narratives, be sure that you try to strike a balance between making them specific enough so that they can identify clear causality. So in other words, don't make them so broad that you're saying, because of a variety of housing issues, families with low incomes, struggle with affordable quality housing. I mean, there are a number of issues in there, as we talked about earlier. So they do need to be, fairly specific. But also, don't go so specific that people won't sort of understand them as one of the causes of poverty in the community. So in other words, if you're writing about some of the health issues in the community, I think it's adequate to say that that there are certain health issues that disproportionately affect low-income families, and that serve as barriers to self-sufficiency. Then your narrative can talk about what some of those are. You probably don't need a different narrative to say asthma is a health barrier and high blood pressure is a health barrier. I mean, they all are, but if you get that specific, you're going to have an overwhelmingly large number of narratives, and people are going to feel inundated. So there's kind of an art to striking the right balance when it comes to specificity. Okay, next. So let me just give you a real quick example so you can see how all of this comes together, and then I'll wrap up my section. So I'm in Rochester, New York. We're in Monroe County. And what we did is we identified each of our narratives as a challenge. So we said in Monroe County, one of the challenges, this happened to be the first one that we identified, was that many adults, not just people with low incomes, but we did want to specify them, many adults, including those with low incomes, face multiple barriers in finding or obtaining jobs that would enable them to be self-sufficient. So the causal mechanism there is a major barrier to self-sufficiency is people's ability to find and or retain jobs. So that's pretty big. And within the scope of the challenge, we talk about unemployment. We show trends that maybe it's declining, but we also show that it disproportionately affects different groups. We also show regional patterns that show that finding and retaining jobs is more of a challenge to people living in the city versus living in the suburbs. And then there's just tons of other data that we get into to sort of paint the picture of why finding and retaining jobs is such a challenge, particularly for low-income families. So that's sort of the analysis part in the scope. In contributing factors, that's where we try to boil it down for people so that we can pull out, well, what are some of the areas that we could maybe focus on to try to improve the situation? Because the scope tells us how big it is and sort of why it exists. Contributing factors helps us zero in a little bit more on specific causes. And so here I gave just an excerpt, and this wasn't the entire set of contributing factors, but we did a survey of our consumer population, and we asked them, what do you find to be barriers in attaining and retaining employment? And the top 5 that they identified were being able to get childcare, both affordability as well as access, transportation issues, educational issues, particularly high school diploma and high school equivalency, lack of a driver's license, and that's something that you don't find in the census data, and limited work history experience. And of course, there are others. But right there, you can see, wow, there are 5 issues that really cry out for a very specific strategy that can help us address this need. And then finally, the last component, opportunities for progress. Obviously, this was not a comprehensive list, but I wanted to give you a taste of how we structured it. We identified organizations that are engaged in activities in this area. We identified a contact person so that there was an actual person people could contact to find out more about this. We have a sort of what is their role in this area. So in our county, Rochester Works is our workforce investment board. So they provide employment and training services. And then we provided a website link so that people could access them. Okay, next. And then just so you could get a sense of how we package all of this very quickly, I provided a table of contents for our community assessment. You can see I have sort of the usual front matter that helps people understand methodology and how we did it, why we do it, an executive summary to summarize all the information, demographic overview, and the faces of poverty, which is really all the poverty rate data. So that's just poverty rates by age, poverty rates by race, poverty rates by gender, et cetera, et cetera. And then you can see that the meat of the assessment was structured by national goal. And so within each of those, we had a set of narratives that basically answered the question, why aren't we achieving that goal? So Chapter 3 addressed Goal 1, people with low incomes become self-sufficient. That's one of our national goals. Well, the narratives answer the question, why aren't people with low incomes becoming self-sufficient? And so hopefully as the reader went through the narratives, they'd say, okay, I get it. I understand what some of the challenges are with people achieving self-sufficiency. And then the last chapter was kind of a next steps that gave people an opportunity to think about how they could maybe partner with our organization. Next slide. And then finally, just think about next directions, and then I'll open it up for questions. Now that we have ROMA NextGen under full implementation and we've got the updated CSBG annual report, it might be helpful to think about how different parts of the community assessment are considering the new family NPIs, the community NPIs, the service codes. Your community may not be doing things in all those areas, but if there are national indicators that suggest that these are key indicators of progress for community action, well, that might be something you at least want to talk about in your community assessment. And I know we will be referring to those as we do our 2019 community assessment next year. And then also thinking about your CSBG annual report, the new community initiatives section, which I think is a really great opportunity for community action to tell its story at the community level. that's a perfect place to tie in the community assessment, because the community assessment should address those issues that ultimately are being addressed in the community initiatives that we report on. So this is just a reminder to think about how your community assessment can explicitly tie in some of the elements of Roma NextGen as you go forward and make your community assessment more Roma informed. So that's how we're doing it here in Rochester in upstate New York. And if you have any questions about that, I'd be happy to try to address those.
Erin, we have had a couple come in. So one of them was, did your organization hire an outside consultant group to perform your community needs assessment? And they mentioned that their tribal government is looking for a partner to do a CNA with them.
We did not, although I know that that's a pretty common practice. I oversee the planning and evaluation department here in my agency. So we actually have a staff of 4 that provide a variety of program support services. And one of our major projects each year is the community assessment. So we do a lot of it internally, but I will say this. We recognize that a really good community assessment is an enormous community project. And so what we've been trying to do is find partners that can take some of the narratives and maybe kind of do them for us. So if you've got some narratives that are talking about employment, maybe you can work with your local workforce investment board and say, hey, this is your area. Why don't we partner on this? You can provide some of the data, some of the analysis, and we'll pull it together into one community assessment. I think it's an opportunity to build some really great partnerships. And it also helps agencies not have to do a lot of the legwork. So that's just one suggestion I would make.
All right, thank you. And to add to that, I know a lot of hospitals and health systems do community health needs assessments. So that could be one area to look in.
Absolutely.
So there's one comment about flipping back to this table content slide. So I'll leave that up as we get this next question. So there's someone that said, I'm assuming that these 4 components would be for each service category. So you ended up saying, this is me talking now. So you ended up saying through these different goals, you went through the 4 components of the narrative. But I think what Reva was asking was, you could use them for different categories such as education, employment, housing, income management. You could do it by domain. And I think the question was that, but I think you answered it that you do it by Roma goal. Is that correct?
That's correct. And we're still trying to figure out what we think the best way would be to approach that as we implement Roma NextGen with our community assessment. And I think that's a decision that the local agency can make, because I think there's a very good case to be made to have the community assessment continue to be topical, but maybe have a narrative approach within those. So your chapters might, instead of going by national goal, they might be Chapter 3, education, Chapter 4, economic development and jobs. And then within those, you have several narratives, and each of those narratives have the 4-component analysis that I described. So there are a lot of different ways that you can kind of structure the overall document.
Okay. Thank you. That's helpful. All right. Looks like we got all the questions that came in as of right now. And so we'll go ahead and transfer over to Lori. Thank you, Erin, very much for sharing. I think that was very helpful. And of course, if anyone does still have questions for Erin, you can go ahead and submit those in the chat box and just note that they're for Erin, and we'll come back to them towards the end when we open it back up for questions again. All right. Well, Lori, I'm going to go ahead and transfer over to you, and then you can go ahead and take it away. Lori is from the Community Action Partnership of North Alabama.
Thank you, Courtney. It's our pleasure to be here representing our agency. Like Erin, our agency did complete our community needs assessment internally, and we looked at several different things, and in preparing for today's presentation, our agency really wanted to walk you through how we came to that decision, things we considered, and then how our community needs assessment shaped up. So, first of all, you need to understand a little bit about our agency. We have 500 employees, and we're a $40 million agency, but, your agency, our agency, they're all configured a little differently, and understanding that and taking that into consideration as you begin your new community needs assessment, you would need to consider those things and how you're structured and what's going to be best for you. So for us, we have a 3-county core CSBG service area. So we're the only game in town as a community action agency in those 3 core counties you see in red. In the green areas, there are sister CAP agencies that provide many services, and we may only provide Head Start, early Head Start, pre-K, housing, affordable housing services and housing development or weatherization. We may provide 1 or 3 or more services in that community, in addition to what their community action agency provides. And then in the blue areas, we provide only housing development as a CHODO, as a NeighborWorks affiliate, and affordable housing services. We actually provide affordable housing services and housing development even outside the state of Alabama. In South Carolina, we have 5 properties there. And so we are an unusual CAP agency in that when we sat down to decide what we were going to do and how we were going to fashion our community needs assessment, we had to determine which counties were in and which counties and service areas were out. And you can see in the red box that, that we stuck to for our community needs assessment those core counties, and also the 13 expanded counties where we offer 1 or more services and we partner with sister CAP agencies. So next, we said, how do we want to use our community needs assessment results? We had to, ask ourselves and frame that up so that we could begin to move further into our process. So first of all, strategic planning was a guide for us. That was something that we knew we would have to use our community needs assessment results for, but not because it was just required, but because it's the right thing to do as a good steward of funds that are given to us. And because if you don't have goals and a plan in mind, you can't measure success and fulfillment towards those goals or outcomes. And then grants, the final product, we wanted our final community needs assessment, final report, to be something useful for grants. As Aaron mentioned, in previous community needs assessments, his agency and ours also ended up with this huge big volume of all this data and all this work that had gone into it, and you went to go write a grant and you had to sift through it, and it really was not user friendly for that. And being one of the grant writers for our agency, it was very important to me and to the other grant writers here at our agency that the final product would be very user friendly, and I'm going to share with you a little bit later in the presentation some of the ways that we did that. So we wanted to be able to blend that quantitative and qualitative data, that need data, and the demographic data in a way that could be useful for our existing grants and continuation grants and new grants that we might be writing for. We also wanted to address stakeholders. We wanted to use our community needs assessment results for the requirements of compliance that the stakeholders put upon us, but also to secure future stakeholders and to educate current and future stakeholders. And then finally, we really were aware of our partners, current and future. We wanted to be able to fulfill our mission, but we know that doing that means that we can't be doing it alone. No one is all things to all people, and certainly our agency isn't. So there are lots of partnerships that take place. Additionally, with stakeholders and partners, something that we wanted them to see in this final product is that there's relevance in our community needs assessment in serving the community's needs, not just Community Action Partnership of North Alabama's needs and programs and services. And Erin mentioned this also, that and so did Courtney, in that there are hospitals and there are other groups, and they have to assess their community. And we wanted to show them a product and present things in a way that they might want to bring their dollars in 3 years from now, partner with us and blend more of what they need and with what we need, and together we assess the community maybe one less time than as many times as we all get surveys to do and be asked to have input in different things. So that helped, knowing what you wanted this end product to look like and how you were going to use it really helped shape what the framework of that we would come together and put together to use. So then we had to consider in-house or consultant, and as I've already told you, we ended up completing our community needs assessment in 2017 in-house. But we had to consider certain factors, and as you're going to consider consultant or in-house, I encourage you to kind of look at some of these as well. Consider your resources. What's your technology? Do you have computers that can handle, that are fast enough and sophisticated enough? I mean, sometimes we have hand-me-downs or we don't have the most cutting-edge technology. What's your internet capacity, your server, your cloud space? The software that you currently have, can it do some of the things? Can you create your own surveys? Can you have access to create surveys and create a polished end result that will meet the needs that otherwise you might purchase from a consultant? Time. What is your staff size, their job tasks? Aaron mentioned that he has a department of, he has 4 that work with him. We're a large agency. I'm the Director of Compliance Planning and Results, and the Community Needs Assessment is part of my job description. But just a few months ago, I got my very first help. Before that, I had been a one-man show. And so you have to consider your time, what is going to be asked of you and the people serving on your committee, and what's going to come off of your plate, whether it's in-house or with a consultant, because even with a consultant, you're going to be feeding some information and working with them, what's going to come off of your plate and still allow you to do the job that you have. You need to consider your expertise, and that is, your ROMA trainers and implementers and the experience that you have of people that can come together in your committee and add value. What experience do they have in grant writing and compliance and training? Because all of that, those types of skills help to write and produce your final product in a way that is appropriate and that's going to be as nice and polished as what a consultant could do. And then your budget. You need to ask yourself, can you afford to budget for a consultant? Depending upon the size of your agency, that can be quite costly. For an agency our size, it was going to be quite costly. And, and you've got to consider that, the consultant's expertise. If you choose a consultant and you choose not to do this in-house, you need to be sure that you're looking at and talking with consultants that have background in CSBG, Head Start programs, and the types of programs that your agency delivers, so that you end up with an end product that is going to be what you really need. So then next you begin to think about the framework and developing your framework. You've decided if you're in-house or you're going to get a consultant, and you want to begin to develop your framework. And to do that, we've got some great national resources and guidance that are fabulous tools for you. You've got the checklist for monitoring community needs and assessment from the state CSBG offices. Those are important because that's that state monitoring tool. In this guide, you're going to find what your state is going to come in and look to make sure that you checked all those boxes and that your community needs assessment met the criteria that they say is the minimum standard. Then you also have the ROMA Infused Guide from National CAP and the Center of Excellence, and this resource guide. Both of these tools were very helpful to us as we began to shape up our framework. Then we built our framework, and both Courtney and Erin have talked about organizational standards and core elements of ROMA, and I in turn would say that's at that point, building your framework, you have to consider those things. You have to have collected information directly from low-income individuals. There are key sectors, 5 key sectors that Standard 2.2 say that you need to have embedded into your community needs assessment, and so you need to be familiar with those and add that into your framework. And then that specific poverty data and gender, age, race, and ethnicity for your service area in 3.2, 3.3 about the quantitative and qualitative data balance in your area. And then those causes and conditions, and the key findings of poverty and the needs in your community assessed. So understanding that and using that to help build your framework will be critical to your success. Then there are core elements of ROMA, and this is where we used our ROMA trainers and implementers. Our agency has 1 ROMA trainer and 3 implementers currently, and hope to have more and getting that more infused into our agency. But having that, those are very helpful. And if you have a ROMA trainer, your trainer has a manual with notes and insight that's that back information that helps them deliver effectively ROMA 101 and complete ROMA training. But there's valuable information in that trainer manual and in those notes that can be of value as you're looking at your core elements of ROMA and setting your framework. So in ROMA, we have a very good concise definition of a community needs assessment being a systematic process for creating a profile of the needs and resources of a given community or target population. It talks about including those resources, and you'll see as we go through other slides, you'll see that we actually call our community needs assessment a community needs and resource assessment. When you're typing it out, and you type CNA and it wants to autocorrect CAN. You don't have to go back and edit if you add the R in there for resources, but we really felt that understanding that resources piece and that core element of ROMA was a real change that we had not spent as much time and given as much attention to in previous community needs assessments, and we really wanted that element to be very strong in our current community needs and resource assessment, and because of how it will influence our strategic planning and our partnerships. But then also there within the core elements of ROMA, you've got that you gather data from a variety of sources. There's surveys, there's town halls and focus groups, and it needs to include customer satisfaction data and agency data. And in the past, we hadn't been so strong in either both the customer satisfaction, but certainly blending the agency data from our historical data and looking at those trends in comparison to some of the other quantitative data, and we wanted to do that, and this guided us to do this. So there's the qualitative and quantitative again, that it has to contain those pieces. And then finally, like Erin had mentioned also, that identifying those 3 levels of need, the family, the agency, the community, because proper identification of the need sets the path for that solution. Whether in the agency or elsewhere in the community, it sets that proper path for being able to address the cause and condition. So once the framework was developed, it's time to think about methodology of the community needs assessment. And for us, this was the time when we selected our committee and decided who was going to be a part of that committee. We reflected on our 2014 community needs assessment. We defined that process of instruments, if we were going to use surveys and focus groups and what data sources, and we crafted a proposed timeline. For us at the Community Action Partnership, we focused our instrument designs on components that included the family and community needs and the most valuable resources available to families and communities. You can see in the bullets that we used the process for our community needs and resource assessment as a collective effort involving a cross-section of key staff from the board and community partners, ROMA trainers, internal and external. We have fabulous relationships with many of the national ROMA trainers, Courtney and Jarl and others. Barbara and lots of other folks helped along the way as we would develop a piece or think about a piece. We would bounce that off of them and just so that we could document and be as thorough as possible and use the collective minds of all the great ROMA trainers that are out there. And we made sure that we followed the full use of the ROMA cycle, as Courtney has showed you earlier, and the cycle that they have put out there for the community needs assessment. We blended those in. We wanted survey sampling that provided a valid sample of the community. Because when we looked back in previous consultant-paid community needs assessments we had, when we went back and looked at county by county, we found that it really wasn't the type of sampling. We didn't get enough in certain areas, and we wanted to be able to control some of that. Acquisition of partner community needs assessments, not just community needs assessments of sister CAP agencies, but also of our areas on aging and the hospital and just other partners, our Chamber of Commerce, the different community needs assessments that were out there that covered some of the same demographic areas. We wanted to be able to look at those and put it against our process of what we did to validate the findings that we were seeing and the trends that we were seeing in a proper fit. And for overall insight, they can do some things that we might see that we should borrow from, and hope that they will see some things that they can borrow from us. And then the publicly available community data that was collected. And we really strived to really offer a variety of qualitative data sources. These are our primary data sources that we used, and most states have more quantitative data sources than you even realize. So we encourage you to compare and contrast the sources that are out there to find the ones that best fit with the programs and services that you provide and the way that you're going to structure your community needs assessment. So then we devised our timeline. For us, it was a 17-month timeline. Keep in mind that the people on our committee that were pulling together to make this community needs and resource assessment come to life had other job responsibilities. This wasn't the only thing that they did, though it was a lot of what they did in the 17 months. And so once we developed our timeline and communicated that, and of course it adjusted some along the way, but you know, you have to have that begin with the end in mind kind of thing of your time. We had to determine our audiences. And in our audiences, we decided that we had three main audiences. Partners, which are those individuals and organizations or businesses with whom we collaborate or have a referral relationship. The community members, the committee identified community members and went back to those 5 sectors of education institutions, the community-based, faith-based, private and public sectors. And then our clients are individuals and families who've been served through one or more of our programs. Remember, that customer satisfaction data needed to come into play, and we needed to be sure that we really heard from them, because they're the ones that we serve, and they are walking in this experience. So we determined that we were going to have surveys in our design, and we decided on 2 surveys to best assess our communities. We determined in our initial methodology that we would have 25 partner or county surveys, and those are the partners that we have within each one of our counties in our service areas. And then we would have a community survey, and we were going to shoot to have 100 community surveys per county. So you can see that we spent some time talking about the public and private sectors and wanted to ensure that across the 16 counties that we invited the same audiences in each of the counties to provide feedback for us, so that we're getting as much apples to apples, as many apple to apples as we can get. And so you can see a list there of the different groups that we identified: clients and board staff, interagency groups, and school systems, with a focus on the homeless liaison, because they know so much about those students that are low income or experiencing homelessness, and we are a housing developer. So those types of things and that particular facet was important to us. But again, hospitals, medical facilities, a lot of these folks are people that we may come back to, and we hope to come back to and say, next go around, would you like to partner with us, and let's do a community assessment maybe together, and eliminate a duplication of survey. So with our surveys, we had the partner survey and the community survey. We launched them through SurveyMonkey, and we collected responses May through August of 2017. We had to use, and as we should, multiple strategies to increase the participation and get the most people to respond to those. And we used social media, Twitter, Facebook, and we boosted the Facebook blowouts in areas that were needed, because you have that opportunity to do that. And so as we tracked, because we wanted to see, we weren't able to before in years past to see as those surveys came in, which counties were very responsive and we were getting great response, what areas within maybe certain counties were not responding, which zip codes were not getting a good balance of responses, where we might want to boost on Facebook and through email and flyers and health fairs and interagency council opportunities, where we might increase participation to make sure that we really got a good balance of responses, so that we could get a good results to consider. So let's look at some of our results. You can see on our partner survey that in the 16 county service area, 302 surveys were completed. In our core 3 CSBG county area, our average was 44 surveys for this particular survey, for the partner surveys. And in the expanded county, we had 25. And remember, our goal was 25, and we really had to work hard. You wouldn't think that you would have to with your partners as much as maybe the community survey, but we really did push those forward and try to promote that. You can see there are some icons. You've noticed them probably on the bottom of our slides. also, you're beginning to see those are our top needs that began to emerge as we looked at our partner and community survey. So in the pink is child care, and that specifically in our survey responses pointed to infant, toddler, and preschool child care needs. Jobs and youth, specifically older adult, and the older adult was that, older aged person that was not quite ready to retire, but they, plants close and different things happen, and so they're not just fresh out of school. They are an older employee but not retirement age. And youth just coming out of high school, maybe those that don't go to college and go to technical school and that kind of thing, jobs and employment for them, and informally incarcerated. With regard to the yellow color, that's food. And our survey results showed soup kitchens, food pantries, and food support programs were primarily that area of focus within the category of food. Green is utility, then that's what you would think, electric, propane, natural gas, utility needs and assistance there. The blue is housing, and our survey results showed safe and affordable rental housing, housing stock for home ownership, home repairs, and weatherization. And then the orange is health care, and that's dental, physical, and prescription assistance. So we've looked at the partner survey results. Let's look at the community survey results. And in our community, in the 16-county service area, we had 1,549 surveys that were completed. In the core county area, the average was 211 surveys for each county. Our goal there was 100. And in the expanded county area, it was 70. And you see those same needs, and they came in, pretty strong. Those came out to be our top 6 needs that we've talked about before. And now we're going to look at the community survey in the 3 core service area and the 13 county extended service area. We began to look at those and took a deeper dive looking at those top 6 needs and seeing how they shook out so that we could frame up what we were going to do next. So we also put a great deal of emphasis on resources, the most valuable resources that were identified in the community from those taking the survey, both the community survey and the partner survey, included governmental organizations. And these are listed alphabetically, not necessarily in frequency of how they shook out, but you can see that our agency made the cut in the 3 county service area and in the 13 expanded county service area. And that was important, but these lists also let us know these were the most valued resources that include government agencies. And we wanted to know that because our partners and stakeholders, some of them are with government organizations and agencies, and they want to know where they fit in as we report out. But we also then spooled those, took those government organizations out and looked at them, how they ranked and how it shook out with the non-governmental organizations, because we knew in the back of our minds that as we look for partners, we have to look at the funding that we have in the funding streams, and we have to be real conscious of not partnering and double dipping government money as we select our partners. So we wanted to show the resources in 2 ways and how they were ranked. So once we had our 6 needs, community needs from our surveys, and looking at some of the qualitative data that we ran alongside and looking at the other community assessments from partnering agencies and validating that, it was now time for us to go to our focus groups. And our committee decided that we would have 2 focus groups in each of the 3 core counties with our community needs assessment for 2017. And that then in the remaining years, we would hit those 13 counties, and in some cases we'll partner with sister agencies where there are other CAP agencies to complete the focus groups in the years in between, and following the same model of 2 focus groups in each county. One of the focus groups, the focus was partners and community members at large. And we tried to hold these focus groups in places that were easily accessible and where we could house folks and let them engage and interact. And then we had one client focus group, and we based those in a Head Start facilities where we had plenty of meeting space there. So when we looked at our focus groups, we sought to validate the survey results and the quantitative data for the 6 needs that we had captured, but we also wanted to design our focus groups in a way to get the causes and conditions behind those needs, and we wanted to glean some quotes from participants to use in our final report. And we recommend audio taping, the reporting out of your focus groups. You may do your focus groups or town halls as large groups, but what we did was we broke into small groups, and they worked on and talked about the 6 needs. Actually, each group had 2 needs, and then they reported out, and there was some large group talking. But we gathered the quotes and different comments that really spoke to those causes and conditions that we felt like would be useful for us in our final report. So in the next 3 slides, you get to see how the causes and conditions by need and by county shook out. And we compared the feedback of the 3 counties, our 3 core counties, and we organized those for our final report with our strategic plan in mind. So you can begin to see that, like in child care, they said a cause and condition where costs were too expensive, lack of child care options, hours of operation were limited, and in housing that homeowners who were now on disability, that their costs were too high to maintain their homes and do the maintenance were needed now that they were on government assistance, or they had limited affordable housing options, or they lacked skilled, honest labor for repairs. But so you have in your slides for you the 3 counties, and in Lawrence County we see that health care, in the need of health care, that a cause and condition was the lack of benefits offered with the jobs, and that governmental programs had strict requirements, costs were unaffordable, and that there were a lack of resources and access to resources. So we give you those slides so that it will help you if you want to follow this framework. It can kind of give you an idea of how those shook together and how we use them for our to prepare for our strategic planning and setting up our final community needs and resource assessment report. So in Coleman County, you can see that jobs and job training, there was a lack of community resources for training programs, personal barriers, limited job attainment and retention, and that there were a lack of jobs in the community. So that's how our causes and conditions spooled out from those focus groups. So we ended up with our 6 top needs, with child care, food, health care, housing, jobs, utilities, and those sub-areas, and we gained clarity and validation as we had hoped through our focus groups. So we pulled it together in a visual, easy way to communicate and to share in our community needs assessment our results. And we wanted to do this in a way so that reporting to board, partners, stakeholders, and for grant writing, that it was easy to see a lot of information and not get an overload of information. So our key here was that in each one of these 6 areas of need, that you could make the connections between the need, the cause and condition, the quantitative data, and then a data snapshot of linking what our agency is currently doing with our services that we provide, all in one snapshot for you. So you can kind of see that coming together. And this is in child care. And let's look at the food and the soup kitchens. One of the things to keep in mind as you're looking at this particular visual with all this information is that we tried to vary our sources that we quoted in our statistical data. Of course, this is just a sampling of what is in our appendix and what is in the narrative of our community needs assessment, but it's a visual that shows some of those links and how it can all work together and gives a good perspective of that need for our service area. So we varied those resources, and this resource came from the American Community Survey, which is part of the U.S. Census Bureau. In healthcare and dental, we also we ended in that community action partnership of North Alabama section where it says what we're currently doing within this need. We also ended that particular section with an open-ended statement setting up for the strategic planning that could be done. So these partnerships have proven successful. The Community Action Partnership may consider additional partnerships to address this key area of need. We're setting up for that strategic planning that is moving forward. In housing, you can see that, let's look at our causes and consequences or conditions. We have written those in a way that you can clearly see those ROMA core elements of identifying the 3 areas of need. Family and community. Communities have limited affordable housing options. Communities lack skilled, honest labor for home repairs. Home repairs are too costly, expensive for individuals and families. So you can clearly see when it's a community need and when it is an individual or family need. And the way that we understood that was through that focus group when we mined out and listened to those participants expound upon that area of need. We were able to more easily identify the causes and conditions. So in jobs and use, again, we wanted to give you all 6 of those needs and let you see this picture. You can see it's clear, it's visually appealing. We hoped that it would easily communicate a great deal of information in a concise way. And let's see if I can get this to advance. There we go. And then we wanted to organize the data in a way that sets up the agency for next steps and community recommendations. So our agency next steps are basically what the agency, as we consider family, agency, and community, what the agency recommendations are going to be coming out of this community needs assessment based on those 6 needs. And we wanted those key findings in the 6 needs, the causes and conditions to serve as a framework for our strategic planning. We wanted the findings to serve as a basis for all program and initiative work plans. So the big agency framework, but then also drilling down into those programs and initiatives and silos that we have, so to speak, into their work plans for their grantors and grantees. And then we wanted to increase collaboration with our most valuable community resources for programs and initiative work plans. So that's what is coming out of this community needs and resource assessment, what our agency is doing internally. We also have a section here, and we included this for you. It's new for us in our community needs assessment. If you remember, we wanted to use the community needs assessment results with stakeholders and partners. And these recommendations can be used by the chamber or by a hospital or a community organization or others to help set the stage for work that they might be doing. It's also designed to show in the areas. It's designed to show that that we could potentially partner for community assessments, needs assessments in the future. And it gives value to our agency that our agency's community needs assessment and our agency has ability to and the capacity to partner at the community level, because for many years our agencies have been more focused on individuals and families than we sometimes realize than really community, and it's in our name. And so we have to re-educate our communities that the results of our community needs assessment and the programs that we provide can also impact the community, and your community needs assessment is a great way to do that. So we've included these slides so that you can see all 6 needs and get the complete picture of how that might look. So finally, this is my favorite feature of the community needs assessment that we did, and these are county snapshots. And if you recall, we talked about using the data from our community needs assessment for grant writing and for stakeholders and partnerships. And we would go to write grants, we'd pull out this huge community needs assessment, and we really were not able to find very clearly and easily the data county by county when we might be writing for a new grant. And so we wanted some snapshots, and they're designed, to be useful for grant writing, but then they're also designed that with stakeholders we can go out and guest speak in a county and take one single sheet front and back that will communicate the results found from our community needs assessment and blend the quantitative and qualitative data in a way that those partner agencies may find useful and may learn more and use it themselves and see the relevance in our community needs assessment and how they might use it. Our partners have really loved this, and you can see on this visual, you can see on the slide there are the 6 needs there, and then you see some big percentages. Well, those are the percentages from Morgan County. In the box below it, you're going to see that that's a cause or condition, but you're probably recognizing some community commons gauges and some different statistical data. Let's take a closer look at a county snapshot. These are 2 different counties. You saw in the last slide the front and back of Morgan County, but in Coleman County, you can see that with jobs and job training, that 39% of the survey respondents said that jobs and job training was a need in their community. And when you look at the gauge there from Community Commons, you see the unemployment rate for Coleman County at 3.2%. You can compare it to the state of Alabama. You see the comparison to the United States, and you can see that that number, 39% of the respondents saying that jobs and job training was important in that community. That's a low percentage for all intents and purposes. And when you look at the gauge and you see that it's green, you can see that, Coleman with that data is well below the state of Alabama and the United States percentage. with our unemployment rate. So it really supports, that works together, those results. You can see that that is supported by the quantitative data that's out there. And then you also can see the causes and conditions from the focus groups that feed up to that need being a need. Let's look at Lawrence County, and you see that on their snapshot that jobs and job training was at 55%, that 55% of the respondents said that that was a need. And then let's look at the gauge, and then you see on that gauge that in Lawrence County the unemployment rate is 4.3%. That's above, it's red, the gauge has got a little red indicator on it, and it's above Alabama's percentage, and it's just slightly above the United States average. So it stands to reason that the 55% of the respondents is very much in alignment with the unemployment rate and why jobs and job training might show as a need for us. If you look down below at the health care, and you see that in Coleman County, 56% of the health care of the respondents said that health care and prescriptions was a need. You look at that gauge in the uninsured population, it's a little bit different. It shows that 14.5% of the uninsured population is in Coleman County's population, is uninsured. And then you can compare that to Alabama and the United States, and you can see that it is significantly greater than Alabama and the United States rate. And so it supports that number, 56%, would be greater. You can look at Lawrence County and see that 50% of the respondents said that health care and prescriptions were a need. And you can see that while that gauge is green and their rate, Lawrence County's rate, is below the rate of Alabama and the United States, it's still perceived as a need. And so this brings a contrast of some interesting information that provides a great food for thought, and maybe some more exploration would be needed there to understand the perception and against the rate. So you get some good information by having the county snapshots, and you can take those out and utilize them in your community to promote your community needs assessment and the results found within the larger document, and then you can hopefully see how that could also be used in grant writing and be a quick, hands-on, useful tool. So finally, and wrap up, you've got information in my contact information and how to get in touch with us should you want more information. And if you have questions or would like additional information, just please let us know. So we'll open it up for questions now.
All right. Well, thank you, Lori, very much for that information. I saw several comments saying that this was some useful information. We'll take the last couple of minutes before 2:30, 2:30 Central Time, 3:30 Eastern Time, to catch a couple of these questions. We did have a few different questions asking about whether participants might be able to get copies of your surveys, or if you have those on your website anywhere for information on what questions you all provide, both Erin and Lori. Do you all have that information publicly available?
We do not have the survey questions publicly available, and they're really long, and a hard copy of those is very difficult to print because our surveys are, if you answer one way, it will route into different strands based on your responses, pointing you into the different needs. So a hard copy is really, really bulky. So no, we do not have that available on our website, and we don't anticipate doing that. But certainly, if you had questions or wanted clarity or whatever, I would be available for you to contact with regard to our surveys. Any questions that someone might have.
Okay. Erin, did you have anything to add?
I don't recall if our assessment is on our website because we've been overhauling it. So I think a lot of things have been sort of pulled off and reassigned. But I would be happy to share anything that we've got if someone just wants to reach out directly, whether it's a copy of our assessment or some of the different surveys and tools that we've used. I'm happy to share what I can.
Okay, great. And people, if you can either enter your email in the chat or people can contact me and I can connect them with you. One question for Lori about the top 6 community needs. Did your surveys ask respondents to write in their top 6 community needs that they thought, or were they instructed to rank pre-identified potential community needs from 1 to 6?
They actually we didn't ask them to rank them 1 to 6. We just had them mark in the needs that there were a long list, but there also were, because we built those on the categories and the domains that fit with ROMA and with the national standards. And but there were areas to write other in, so people were able to write if there was something that they felt was missing. But we didn't say, oh, you have to rank only 6 or only 10. And we weren't sure when we went and looked at the results if we were going to end up with 5 top needs or if we were going to have 6 or whatever. We looked at how those ranked, and then as a committee decided, because they were so close, we really couldn't. We thought 5, and we ended up with 6. But we didn't ask. They could have ranked 10, and ranked it on 1 to 10, or however they wanted to do it, or they could have done 15, or whatever they felt. We did not want to box them in, and then we just looked at how everything sifted out.
Okay. All right. Well, there are a few questions that were kind of directly to you, Lori, just about how you presented your community assessment results. So since your email address is right here on the screen, I'm going to go ahead and refer people that any direct questions like that, go ahead and just email Lori directly. She might be able to share that information. As far as other questions that will definitely interest everyone, the slides will be posted to the website within about at least 2 business days, if not, hopefully if we get them up there today. I did also get several of your email addresses, and we'll make sure that that we get back in contact with you, or if we don't get back in contact with you on what exactly you were wanting, just let us know by emailing me, and I can get you connected however we need to. Let's see. Trying to see if there's any other questions I need to address right now. I think that's about it from what I can tell. My computer's actually malfunctioning right now, so I can't scroll up to some of these questions. But there we go. Okay. One question I did want to go ahead and pose, and then we'll go ahead and close the webinar, is whether either of you offer Head Start services, and if yes, do you incorporate the Head Start needs assessment into your overall community assessment, or keep them separate?
Well, that's a great question. Yes, we do operate Head Start, and you have put your finger on one of the sore spots that we deal with every single year with the community assessment. And so I guess my short answer, because I'll spare you the drama that goes on year after year, the short answer is we've done it both ways. And I don't know that one way is better than the other.
Okay.
Yes, we have Head Start, and we have early Head Start and pre-K programs, and home-based and center-based child care services. We have provided, we've always had one community needs assessment, but we always have a section that is an addendum for additional Head Start information. And Head Start requirements guide a great deal of how we structure what we do in our community assessment.
All right. All right. Well, thank you both very much. Appreciate your time with this webinar today and sharing. And we will go ahead and be sharing all of the slides that you saw today. So those will be able to be shared on our website along with the recording. And then just follow up with me. I'm going to grab some of your emails that you've sent me and make sure we get you what you need. But otherwise, just follow up with me. My email is on the screen, Courtney Kohler, Senior Associate with the Training and Technical Assistance team at the partnership. And we'll get you connected or get you the answers that you were wanting. So thank you all for joining us today. We appreciate it. And thank you again to our presenters.